Peripheral artery disease is a common circulatory problem in which narrowed arteries reduce the blood flow to your limbs. Approximately 8 million Americans have peripheral artery disease, including 12 to 20% of adults 60 and over. Yet only 25% of Americans are aware of this disease. Dr. John Wesley with Vascular Specialists and Orlando Health has joined us now to explain who's at risk and exactly what is peripheral artery disease. Thank you so much for joining us.
Thank you for having me again.
All right, so let's just start off at the beginning. Let's tell everyone, what is PAD, peripheral artery disease? What is it?
So peripheral arterial disease is a condition in which blockages of arteries prevent the distribution of oxygen-rich blood to local tissues. In this particular instance, it's the lower extremities. Those blockages occur because of plaque, or what we call atherosclerosis of the arteries.
So who's at risk for this? I mean, senior citizens, particular genders, who needs to be aware of it?
Well, that's a good question. Number one, this is a condition of aging. So generally, the older you are, the higher risk you have for having peripheral arterial disease. Men have a slightly higher risk for having peripheral arterial disease than women. But the two most important risk factors are really smoking and diabetes, as well as hypercholesterolemia, so having high cholesterol, high blood pressure, genetics. All of those things influence who's at risk for developing peripheral arterial disease.
So what are the symptoms? What should people be on the lookout for? You know, are there warning signs?
There are. The most important thing to note is that because peripheral arterial disease restricts blood flow to the organ, the symptoms are related to what organ's affected. Now, in this case, we're talking about the lower extremities. And so the symptoms are related to the inability for the muscles to get the oxygen that they need to do what they normally do, which is walk or dance or hopscotch or whatever the legs happen to do at that time. And so the most important and the early symptoms are pain in the legs while walking.
Okay.
As the reduction of blood flow becomes more and more severe, then the pain starts to happen at shorter and shorter distances. And then in its worst form would be pain at rest and even sores that develop on the feet as the tissue actually starts to die.
So it's something, it sounds like it's progressive then. So
that is correct.
As someone notices that something is getting worse, that would be something to be concerned about.
Absolutely.
Okay. What kind of a doctor will treat peripheral artery disease?
So there are a number of different specialties that may manage different aspects of peripheral arterial disease. That includes internal medicine and cardiology and family medicine. But peripheral vascular surgeons, which is what it is that we do, are the only specialty that's trained to manage the comprehensive management of peripheral arterial disease. And that ranges from medical management on to surgical management.
So what would be some of the treatment that you do?
So the most important treatment for peripheral arterial disease is changing our lifestyle. The most important thing is to control our cholesterol and to stop smoking and to control our diabetes if we have that. Obviously, we can't change the fact that we get older, we can't change our genetics, but those are the most important things that we can do to treat peripheral arterial disease. Now, in addition to those things, exercise and certain medications may increase our ability to walk further distances. And then in severe cases, angioplasty, what we call atherectomy, which is cleaning out the artery, and maybe even bypass surgery may be used in order to get better blood flow down to the tissue.
And peripheral artery disease can be very, very serious.
That's correct. The main reason why peripheral arterial disease is serious is because the plaque that forms in the arteries that go to the leg also forms in the arteries that go to the brain, that go to the heart. So having peripheral arterial disease increases your risk for dying from a heart attack and a stroke. So managing the condition in general with the maneuvers we talked about earlier, which is controlling those risk factors, is the most important thing we can do to control it because of the increased risk of having a heart attack and a stroke.
So it's very, very serious, something people definitely should be taking
Absolutely.
seriously. How can folks reach you?
Well, you can reach me on our website, which is www.ortho, arteryandvein.com, all one word.
Easy to remember.
Very easy to remember. The phone number to the office is 407-648-4323.
All right. Well, Dr. John Wesley, thank you very much for sharing with us peripheral artery disease and what folks need to be aware of. We definitely appreciate it. And hopefully you have been listening and you know what you can do to help to prevent peripheral artery disease in you or your loved ones.